For me, emergency medicine is all about saving lives. We are there when you need us most, whether it be at 3 o'clock in the morning or on Christmas Day. Emergency doctors are there to help your pets. We work with all different types of species, from dogs and cats to exotics to even goats and pigs. People bring us a variety of animals of all shapes and sizes, be for any reason, from a serious medical emergency to an ear infection. Arguably, most importantly, we are there to serve a valuable need in our community by providing a break for general practice vets so they don't have to be on call all the time. We also perform a valuable service for our community of pet owners in that we're available 24 hours a day to help you when you need it the most. For those who are unaware, there is a difference between what we do at an emergency hospital versus your general practice vet, in that an emergency vet is there for health concerns that need immediate attention, and we are trained to quickly triage and stabilize your pet, and we have the resources available to perform life-saving interventions if necessary. A general practice vet is there also to help in emergencies during their normal business hours, but they also manage your pet's chronic health issues and manage your pet over its lifetime. So our goal as an emergency vet is to stabilize your pet to get it back to its general practice vet for management of whatever disease process is causing the issue. So onward to our topic for the day: is this an actual emergency? First, I want you to ask yourself these questions. Has my dog's behavior changed? This we will go into more detail about on the next slide, but this is kind of the most important question to ask yourself. Next, is your dog breathing normally? Is your dog's appetite the same, or has it changed? Is your dog drinking water normally? Is your dog urinating and defecating normally? And is your dog throwing up repeatedly? As far as behavior goes, remember that you know your dog the best. When I think of behavior, I think of my dog's physical and emotional behavior. So is my dog acting normally? Is my dog moving normally? Is it, he now limping, or is he unable to bear weight on one of his legs? Is he more lethargic than normal? Is he vocalizing more than normal? Etc., etc. This could be any behavior change that is abnormal for your dog. In order to walk you through this, I wanted to introduce you to some of the most common critical cases we see in the emergency room. We will be discussing the cases that are bold on this slide and kind of walking you through different situations in which this would actually be an emergency and you would want to go see an emergency vet as soon as you can. First, we are going to talk about bleeding. So there's a difference between bleeding from an orifice. An orifice is any opening into the body, whether that be an ear canal, eyes, nose, back of the mouth, anus, vulva, penis, urethra, any opening directly into the body, versus a surface wound, which could be, in this example, an ear flap, or anywhere on the body, just a skin wound that is causing bleeding. The first patient we're going to look at is a dog named Bo, who is a 4-year-old male intact, which means he is not neutered, Doberman Pinscher. He was out playing in the yard when he started bleeding from his nose. The bleeding hasn't stopped since you first noticed it. It was a few minutes ago. Is this an emergency? So we're going to go to our questions and ask ourselves the 6 questions that I told you about earlier. And in this case, the one that would be most relevant is your dog is bleeding from its nose, so it's likely not able to breathe normally. So in Bo's case, this is an emergency. Bleeding from any orifice, like we mentioned before, the nose, eyes, mouth, ear canals, vulva, penis, urethra, anus, or bleeding that doesn't stop after a few minutes, both warrant a visit to the emergency vet. In Beau's case, he had a genetic disease that is common in Doberman pinschers called von Willebrand's disease that prevents him from forming a clot effectively. So he was taken to the emergency vet after they noticed bleeding from his nose, and he was stabilized there and treated with a blood transfusion at the emergency hospital. This disease is confirmed with genetic testing that is typically done by the primary care veterinarian. So at the emergency vet, we would stabilize him, give him a blood transfusion, and then refer him back to his primary care vet for the genetic testing. There are other reasons why Beau could be bleeding and not clotting very well. This could be toxins such as rodenticides like warfarin that can cause prolonged clotting times, meaning that he wasn't clotting in the right amount of time necessary in order to stop bleeding. So if you are concerned, make sure you look around your house for anything your dog could have gotten into. It doesn't have to be this genetic abnormality. It could be a toxin that your dog has ingested that is causing clotting abnormalities. Next, we will meet Beau's companion, Teddy. Beau is feeling much better after his trip to the emergency vet where he got his blood transfusion, and now Teddy and Beau are outside. Teddy tried to chase a squirrel over the fence in the backyard, but he ended up scratching his ear in the process. You notice Teddy's ear is bleeding, and you take out your first aid kit, you clean off the ear with soap and water, and you notice a small scratch on the ear flap. You apply pressure to the ear with a dry piece of gauze or a clean napkin, whatever you have that's clean that you can stop the bleeding with. The bleeding stops and you're relieved because you just dealt with Beau in the emergency vet. You begin to walk away when suddenly Teddy shakes his head and the bleeding starts again. Is this an emergency? We go back to our questions here, and everything is normal with Teddy. His behavior is normal. He is breathing normally. Nothing is out of the norm for Teddy at this time. So, should you take Teddy to the emergency room? Technically, you don't have to. There are areas of the body in which there are more blood vessels that cause more bleeding than other parts of the body would. Ears especially have a tough time healing, and dogs tend to shake their heads a lot when they have an ear injury, which can impede the healing process by knocking off the scab that forms over the injury. So, if your primary care vet is unable to see Teddy and you don't want blood all over your house by your dog shaking its head, you can take him to the emergency vet for proper bandaging and/or stitches if the cut is deep enough. So what can you do if your dog is bleeding? First, you determine where the bleeding is coming from. If it's coming from an orifice, like I mentioned previously, this is considered an emergency. If you notice an open wound that is bleeding, you can try to put pressure on the wound and see if the bleeding stops. If your dog allows you to, sometimes these can be painful, but regardless, your dog should start forming a clot after a few minutes. And if they don't, then you can look and see if your dog has gotten into anything, whether that be a blood thinner or a rodenticide or something else. Any information you can provide your veterinarian is better than nothing. So if you're unsure, gather anything you think your pet could have gotten into and bring it to your veterinarian. When in doubt, return to those 6 questions and ask yourself, has my dog's behavior changed? Is he breathing normally? Has his appetite changed? Is his water intake the same? Is your dog urinating and defecating normally, or is he throwing up repeatedly? If you're still unsure, you can always call your local veterinarian. Onward to our next case, which is my own personal dog, Apollo, who at the time was a 2-year-old male-neutered mixed breed dog. I found a bottle of Advil knocked off of my nightstand and the pills were scattered all over the floor. Some of them might have been licked, but it didn't seem like he ingested any of them. So is this an emergency? I went back to the 6 questions and I asked myself, has any of this changed with Apollo? And the answer was no, he was fine. So I decided to wait. One day later, he ate some cat litter and he regurgitated shortly afterwards, but otherwise he was normal. 2 days later, he regurgitated his breakfast and then I took him for a walk and his urine was completely clear when normally it was bright yellow. Is this an emergency? I went back to my 6 questions, and now his urination had changed. Normally his urine was bright yellow, and now it was completely clear, and he had regurgitated twice at this point. So I decided to take him to the emergency vet. His emergency vet took a history, ran blood work, and they took x-rays just in case he had eaten something that was causing his clinical signs, like a foreign body. His blood work showed that he had indeed ingested Advil, and he had acute kidney injury, and he was hospitalized for 4 days. He also developed stomach ulcers, which was kind of a late side effect of the Advil toxicity, which caused him to have black and tarry stool while he was in the hospital. So yes, it was indeed an emergency.